Hello, my name is Joan Kentz. I'm a nurse and I've been in charge of programs in hospitals and public health for over 40 years. Personally, I've had both employee health coverage and private coverage for that entire period of time and now have Medicare and a private Medigap policy. Throughout my professional career, I have closely followed the quest for quality, affordable health insurance for everyone. Since we understand how a democracy works, the question I think we need to consider is how can we most effectively and practically reach that goal? Although there is much discussion about Medicare for all, there is little mention of what is referred to as Obamacare. During this most critical election, my concern is how many Americans really know and understand the Patient Protection Affordable Care Act, which is the actual name of the coverage, and how the Patient Protection Affordable Care Act comprehensively changed the way health care is practiced for all health insurance coverage. We will start by looking at the challenges of working for that intention, even with obtaining only 40% of the funding and facing numerous obstacles. Let us look at what was accomplished by passing this historic legislation. The quest for health insurance. It has been nearly a century since Teddy Roosevelt first called for health reform, and ever since, every president and Congress, whether Democratic or Republican, has attempted to meet the challenge in some way. This was a quote by Barack Obama looking at what has transpired in our country and trying to obtain health coverage for all. There was 100 failed attempts. Now, why was that? Well, there were many formidable obstacles. There was fierce opposition from stakeholders such as the insurance companies, the physicians, the hospital associations, and the pharmacy associations. We saw fragmented political institutions as we see at all times, and skepticism about government. Now, if we had had the coverage that Obama had favored, it would have had a public option, but it had to be eliminated, unfortunately, in order to pass. Opponents decried government takeover and death panels, which did not exist. And then finally, there was a first vote in the House, which passed by a slim margin. However, the Senate voted down 54 to 45 due to abortion concerns. And then life interspersed with politics affected the passage of the legislation. A big proponent of healthcare throughout his career was Ted Kennedy. And by losing him at this point during the healthcare legislation process, we were short his vote, a very important vote. And then there was a Senate race for his seat, and unfortunately, a Republican won. So, faced with this problem of not having enough votes to pass it through the Senate, Nancy Pelosi and Harry Reid decided as a last-ditch effort to use the budget reconciliation process. This is a much more convoluted system, but they felt like this was their only chance. The House approved the legislation, and then the Senate had passed it with a promise that the Senate would approve amendments. Then the Senate approved the amendments or the fixes, and then again, it had to go back to the House. The Patient Protection Affordable Care Act was signed into law by Obama on March 23rd, 2010. And this was not the final signing. We needed to also have a bill signed for the amendments or the fixes, which took place on March 30th, 2010. Our problems were not over at this point. The attacks of the passage of the bill, as many of us remember, were ongoing. Following the 2010 election, Republicans pledged to repeal. Republicans voted in the House 245 to 189 to repeal. Fortunately, 1 month later, the repeal failed in the Democratic Senate. However, they weren't finished with more assaults. Republicans voted 50 times to repeal during the Obama presidency. And other problems that were created were they questioned the constitutionality of the mandate, which had to go before the Supreme Court. Fortunately, John Roberts upheld the legislation in 2012. However, when a new president came in, President Trump, Republicans signed into law repealing the individual mandate. So it's been a long, long process, and it's still ongoing. But what we were able to manage through all the obstacles was to provide health insurance for millions that had not had coverage. And then in addition to that, we were able to change all of healthcare. And we're going to focus for a couple minutes on this. I know many of us are aware of the fact that some of the protections that the Patient Protection Affordable Care Act gave us were policies that cannot be denied due to pre-existing conditions, which changed healthcare immensely, and that dependents can stay on parents' policy to age 26. However, there are many more protections. And remember, too, these protections are not just for individuals that finally had health care coverage. These protections extend across the board of all health insurance, whether you have employee health insurance, private health insurance, or Medicare, you now have these protections in place. Charges are for outcomes and not individual procedures, which help to decrease the cost of healthcare. Insurance plans can no longer cancel policies at will. A very important one is preventive care became the focus and is offered at no cost, which should be the cornerstone of all health care. Limits on lifetime benefits and annual limits are banned. So, for example, if an infant is born with many, many congenital problems or issues, they might go through their lifetime limits prior to this in 1 year or their first year of life. That is not possible now. There are no lifetime limits. More protections were offered through Medicare services. They were expanded to cover low-income individuals. Medicare Part D donut hole coverage improved, and that is still being phased in. Most plans cap out-of-pocket expenses, and very importantly, mental health, substance abuse, and maternity care are routinely covered. So, in summary, the Patient Protection Affordable Care Act was landmark legislation. It changed the practice of healthcare by expanding healthcare coverage, slowing the rise of healthcare costs, offering comprehensive protections to all insured patients, and it increased the quality and efficiency of health insurance.